Hi everybody, in this video we're going to move on through our discussion of the bones, and we're going to be talking about the pelvis or the pelvic girdle, which we see here. Pelvis is often a word that's used a little bit incorrectly in that there is not a specific bone in the body called the pelvis, but pretty much everything we see here makes up the pelvic girdle or the pelvis. We also see a couple of lumbar vertebrae and some vertebral discs here, which are not a part of the pelvis. But the pelvis is made of, here we see the sacrum, which are fused vertebrae that we discussed briefly in the vertebrae video. And then it seems to be missing here, but there is a coccyx. Remember, those were some fused vertebrae, often just called the tailbone. And then we also have two hip bones, which really the correct term is os coxa or coxal bones. So we're going to be looking at those coxal bones individually and learning the names of the three bones that make up each coxal bone, as well as several markings and how to distinguish right and left. But before that, one of the things that you're going to have to know is whether or not one of these pelvic girdles is male or female. And your lab manual gives you a few different methods, one of them being that the female pelvic girdle tends to be wider and the opening tends to be a little larger, which is typically the case. However, in some instances, if it is a very large male compared to a very small female, sometimes that can throw off the proportions, and you can mistakenly call one male when it's not, or female when it's not. The best way for me personally is when we turn the pelvis over and we see kind of this U shape right here versus this V shape right here at the pubic symphysis. Well, that is an easier and more reliable way to distinguish between males and females. Because if you see this U shape right here, think uterus, and females have a uterus while males do not. Whereas over here, if we see a V shape, you could think vas deferens. Males have a vas deferens while females do not. And that's how we can distinguish between male and female pelvis. V shape is a male, U shape is a female. So now here is one of those os coxa or coxal bones that I was talking about, and I've drawn on here so that you can see where the three bones that make up one os coxa actually separate. The three bones that make up one os coxa is the ilium here at the top, the ischium, which is the lower back portion, and the pubis, which is the lower front portion. So up here, the ilium is anterior, ischium is the inferior posterior, and the pubis is the inferior anterior. So those are the three bones that make up the os coxa, and these lines here show us where each of those bones ends. So we're looking here at a right os coxa, and we'll see where they, or how we can tell the difference in right and left on the next slide. But we're looking at the lateral portion of this coxal bone. And if we were to be standing, let's say, to a person's right and look at their right hip and somehow have x-ray vision, this is pretty much the view that we would see. So let's look at the markings that you're responsible for knowing on one of these coxal bones. you do need to know the 3 bones that make up one os coxa, as well as this raised part right here. When you put your hand on your hip, this is really what you're putting your hand on, and that's called the iliac crest. That's this upper arch right here. This is the iliac crest. Now, this large indentation right here, that's called the acetabulum, and that's where the head of the femur attaches. That's how your leg attaches to the rest of your body. This is the acetabulum. Now, this portion on the right of your screen, this is the anterior side of the coxal bone, whereas this portion on the left of your screen is the posterior side. So let's look at the markings right here, this point, and right here, this point, as well as these 2 points right here. All 4 of those points are called iliac spines, but we need to be able to specify which one we're talking about. So as long as you know your directional terminology, we can be more specific with our naming. We said that this was the anterior side. So this is the anterior, and so is this. Since this one is above, we call this one the anterior superior iliac spine, while this one is the anterior inferior iliac spine. Now the ones here, they're going to follow the same naming scheme. This is the posterior superior iliac spine, and this is the posterior inferior iliac spine. So all 4 of them are iliac spine, but they just have different names based on if they're on the front or the back, the top or the bottom. Next, we have this very sharp dip right here. Now this sharp dip, that's called the greater sciatic notch. And there is a small dip right here called the lesser sciatic notch. They are separated by this point right here called the ischial spine. So the greater sciatic notch, lesser sciatic notch, separated by the ischial spine. Now down here below the ischial spine, we have this very large kind of swollen area, very different from the other side here, which is very flat. So the part that's very swollen is on the ischium, and it is called the ischial tuberosity. Remember from our previous video, tuber is a root word that means like a potato or other root vegetable, a tuber. So a tuberosity is a large swollen area, and this is the ischial tuberosity. Here on the front, on the pubis, this area right here is what forms the pubic symphysis, where it meets with the pubis of the left os coxa. So this area here is called the pubic symphysis or the symphysis pubis. Finally, this large open hole right here is called the obturator foramen. Obturator foramen. Those are the parts of each os coxa that you need to know. But as I said, you need to be able to determine right and left if you only have one of these in front of you. As I said before with the scapula, the trick to learning right and left is pick out some features that are obvious to you and know which direction they are supposed to face in anatomical position. For me, when I'm looking at one coxal bone, I think this arch right here, the iliac crest, goes up because that's what you put your hand on when you put your hand on your hip. this part right here, the ischial tuberosity, when you sit down, that's what you're sitting on partially. So that goes back, that goes posterior. And this big hole right here, or this big indentation, the acetabulum, we said that's what the head of the femur attaches to, so it has to face outward to the side of your body, so that faces lateral. Now for this one on the left side of your screen, for the iliac crest to be upward, for the ischial tuberosity to be back, and for the acetabulum to face outward to the side of the body, the one here must be a right, whereas this one must be a left. So it is as though we are facing the patient here. Now they are by no means positioned correctly. Really, if this were positioned correctly, the two pubic symphysis would join. But on the right of the patient, here it's on your left. Here the left of the patient is on your right, as though you are facing the patient. So make sure to know what the correct names of everything as far as bones, as far as markings, whether it is a male or a female, and whether it is right or left come exam time.